So, Dr. Katz, what are some things that you talk to your patients about when it comes to reducing the incidence of stroke and heart attacks?
I normally focus on the same things that a lot of physicians like yourself probably do. Talk to our patients about the things that are in their control. You can't change your genetics or your predisposition to possibly suffering a future heart attack and stroke. But you can not smoke, exercise regularly, eat a healthy diet, watch your salt intake, avoid excessive alcohol intake. And if you do have conditions that can predispose you to future heart attack or stroke, like high blood pressure or high cholesterol, trying to control them, both with those lifestyle modifications or with medications if necessary. So Dr. Cathari, what are some tips you share with your patients in trying to prevent future heart disease?
That's an excellent question, Dr. Katz. It's something I discuss with patients in the office routinely. As you know, eating a healthy diet rich in fruits, vegetables, whole grains, proteins, and low fat is absolutely important. Maintaining regular exercise level. The American Heart Association recommends 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise. It's also important to maintain a healthy weight that's within the range of your height and your build. Even losing a little bit of weight can have significant impacts on your overall health. It's also important to cut out vices like smoking. Smoking is one of the biggest risk factors for the development of heart disease. It's also important to limit the alcohol consumption and keep things in moderation. Managing stress levels is absolutely important as well. You can utilize techniques such as yoga, meditation, deep breathing, or other hobbies that keep you in a clear state of mind. It's important to maintain routine follow-up with your primary care provider so you can maintain control of your blood sugars and your blood pressure. One thing that often goes overlooked is understanding and knowing your family history. Genetics play a huge role in the development of heart disease, and knowing where you lie on that spectrum will allow your primary care providers to appropriately risk stratify you. At the end of the day, it's important to remember that making small, sustainable changes will have an overall impact in the long run. But before making any of these changes, it's important to talk to your healthcare provider, especially if you have any pre-existing conditions.